Welcome to Sex Talk. This is our first episode of a podcast courtesy of UCSF Student Health and Counseling Services, a frank discussion about sex. We hope you'll email us through our website anonymously and ask us any questions that you might have about sex. I'm Lisa DeGiorgio-Haig, one of the nurse practitioners here, and I'll be hosting Sex Talk. Our first topic is going to be Condoms 101. Over my years of practice here at UCSF, I've gotten a lot of questions from men and women about condom use, and we decided this would be a great first topic for discussion. Condoms are a great idea for anyone having sex with a man to prevent infection, and if it's a woman having sex with a man, they also help to prevent pregnancy. They don't work 100% of the time, but they'll greatly reduce your risk of STDs and pregnancy. I always say, it's best to be prepared. It takes two people to have sex, and both parties should be involved in the preparation. And it does take some preparation for it to be a good experience. If you're sleeping with someone, you should have enough respect for them to protect them. So I always recommend having condoms on hand. Sometimes people will say, well, my partner will think I have an infection if I show up with a condom. But actually, I think in this day and age, most people really appreciate someone who shows up with the necessary stuff to make the experience a good one. What if I don't have a condom and I'm in the throes of passion? Well, if you don't have a condom, either stop what you're doing and find one, because sometimes somebody has one in a desk drawer or bathroom or their roommate's room, and there's convenience stores, they're pretty easy to get. But if you just can't get a hold of a condom, don't have intercourse. There's a lot of fun stuff that you can do that you don't need a condom for. So I would say if you don't have a condom, try something else. Get creative. Okay, so once you have a condom, it's important not to carry it around in your wallet for like 6 months because they deteriorate and they have expiration dates. So you want to keep your stash in a cool, dry place. And it's okay to put it in your wallet or your makeup bag when you're heading out for the evening. Always bring a backup or two. And just don't store them in there and then try to use them after 6 months. When it's time to use a condom, I always highly recommend that both men and women practice using condoms when they're by themselves. Nobody wants to try to figure out how to use a condom when they're, getting hot and heavy with a partner. That is not the time to figure out how to do it. So men, women, when you're by yourself and your roommate's not going to walk in on you and you're in a relaxed environment, check it out, open it up, masturbate with one on, figure out what it feels like, practice putting them on and taking them off, so that when you're with a partner that you care about, you can look smooth. Women, you can practice with the good old banana or any kind of seasonal fruit or vegetable that fits the bill. And I do recommend that both men and women practice using condoms, because one of the keys to using a condom is incorporating it into sex play. A lot of people freak out about stopping having sex and fumbling with the package and putting it on, the 40-year-old virgin thing. But this doesn't have to be the way if you know what you're doing. You can ask your partner to put it on. That's perfectly acceptable. And if your partner doesn't know how to put it on, take the time to teach him or her. You're doing a service to humanity by doing that. And you're looking like the knowledgeable person in the bargain, which only makes you look smooth and cool. You can buy them really inexpensively at Student Health Services. We sell them for $3 a dozen or $7 for 3 dozen, which pretty much anybody can afford. If you feel like you can't even afford that, come to my office and we'll figure something out, because we're really in the business of helping people be safe. So other people will say to me, there's so many different kinds. What's the in and out of condoms? So I'm going to break it down a little bit. Basically, they come in latex and polyurethane. Latex is what I usually recommend unless you have a latex allergy. And only a small amount of people are allergic to latex, but if you are, you can buy polyurethane condoms. Size of condoms. So condoms come in different sizes. My recommendation is be honest with yourself. Don't buy a Magnum if you're not a Magnum person. Most people can use regular condoms. And when they say large and small, that refers to the width of the condom, not the length. The reason you don't want to lie to yourself is because if a condom is too big, it can slip off, and if a condom's too small, it might break. So just try to be honest. Lubricated versus non-lubricated. Usually for intercourse, anal intercourse or vaginal intercourse, I recommend lubricated condoms. Usually the non-lubricated condoms are reserved for oral sex. Spermicidal. Some condoms have a spermicidal lubricant. I think these are less common now. They used to be more common. They were commonly lubricated with a spermicide called Nonoxynol 9, which can be helpful in preventing pregnancy, but you should never use it for anal sex because it can cause an irritation to the tissues that can make you more susceptible to infection. Ribbed versus non-ribbed. Ribbed condoms are great for the guy who says, when I put on a condom, I don't feel anything. Ribbed condoms can be helpful for that. Colored makes no difference in their effectiveness. Some people think it's funny to have an orange or a red or a green penis. If that's your thing, get colored condoms. There are flavored condoms. These are for oral sex. They come in many different flavors. And reservoir tipped, most condoms have a reservoir tip to catch semen, and it's important when you put the condom on that you squeeze the air out of this reservoir tip so it has room in it. As far as putting a condom on, there's lots of YouTube videos if you want to view them. It's pretty easy to do. When you tear the package open, make sure you're not tearing the condom. Don't use your teeth to tear the package open because there can be micro tears in the latex that you definitely want to avoid. And make sure it's unrolling the right way. You put it on the penis and you roll it down to the base. You put it on when the penis is erect. And if you're using condoms, you definitely don't want to have any contact before you put the condom on. A lot of couples will tell me, oh, he puts it in, then he takes it out, then we make out, then he puts it back in, then he pulls out, then he puts the condom on. That's not a good idea. That's kind of like Russian roulette because semen leaks out before a man even feels that he's ejaculating. So if you're gonna use a condom, which I highly recommend, you want to put it on from the start. As soon as the penis is erect, put the condom on. And for men who are very, very sensitive, which a lot of young men are, the condom can even help you maintain your erection by reducing that sensitivity a little bit. I've had people ask me if it's safer to wear 2 condoms. Absolutely not. Do not wear 2 condoms. The friction of the condoms rubbing together can make them break. So once the man ejaculates, he needs to hold the condom around the base of his penis and pull out. A lot of couples like to stay connected, but when you're using a condom, this just is not a good idea because the penis loses its erection and the condom can fall off. So you do need to withdraw holding the condom on after you ejaculate. I just want to make a comment about lubrication. Lubrication, or lube, is a cream or jelly that's used to sort of make sex go more smoothly. So if you're dry or there's some difficulty, lube can really be helpful. There's a lot of lubricants on the market. I tend to recommend Astroglide, but there's flavored lubes. There's all different kinds on the market. So go buy yourself a little sampling of lubricants and see which one you like. What you don't want to do is use something like Vaseline or olive oil because those can break down the latex in the condom. So you should definitely use a real lubricant that's intended for sex. And it can also be helpful if you're dry in preventing the condom from breaking. So thanks for listening to our first episode of Sex Talk with nurse practitioner Lisa DiGiorgio Haig. I'm at Student Health. If anybody wants to come talk to me face to face, and we're all about people who are sexually active having great sex, and we're here to help. Take care. Bye-bye.